Hello everyone, I'm Dr. Sowmya, Obstetrician, Gynaecologist Laparoscopic Surgeon at Femcity Hospitals. Today I'll be speaking anything and everything about Pap Smear. Now, what is Pap Smear? It is a screening test for cervical cancer, where it can detect the abnormal cells in a very early stage, that is in a precancerous stage, when it can be treated or even be cured completely. Now, what is cervix? Cervix is the lowermost part of the uterus. It is also called as mouth of the uterus. That opens into the vagina, lies at the uppermost part of the vagina, sitting deep inside where it is not visible externally. So, why is screening for cervical cancer important? Every woman who has a cervix will have a chance to have cervical cancer. And India itself accounts for 1/4 of the cases of cervical cancer worldwide. So screening will save millions of lives. So what is the most common cause of cervical cancer now? The HPV infection. So there are 200 different types of HPV viruses. So HPV infection is, every woman will acquire HPV infection in one or the other part of her life. But the best thing is, every woman's immune system will have the ability to fight against HPV infection. So if you have HPV infection, it doesn't mean you will have a cervical cancer. Only prolonged exposure to HPV will cause cancer. There are a few different ways to screen for cervical cancer. One is a Pap test. It is also called as Pap Smear. So it involves taking cells from the surface of the cervix and sending them to the lab. Then an expert, that is the pathologist, will see the cells under the microscope and will tell us whether the cells are normal or changing into cancer. The second one is HPV test. HPV stands for human papillomavirus. Some type of this viruses can cause cervical cancer. There are 200 different types of HPV viruses, among which only few are high risk for cervical cancer. The HPV testing involves testing the cells from the cervix again for certain types of HPV which are high risk. Or the third one is combination test, where we combine the Pap Smear with the HPV testing at the same time. What happens during a Pap Smear or the HPV test? For both of these tests, your doctor will take the cells from the surface of the cervix to do this. That will be by gently inserting a speculum into the vagina, and the device. What will the speculum help? It will help to push the vaginal walls apart so that your doctor can see the cervix well. Then they use a small tool to lightly scrape the cells from the surface of the cervix. The tools like spatula or a brush. So this might be little uncomfortable, but it is usually not hurtful. So when should we start being screened for the cervical cancer? That's the next question. So most of the experts or the doctors will suggest you to have a Pap Smear from the age of 21. But few even suggest to have the Pap Smear from the age of 25. So you should start getting Pap Smear test at the age of 21 years, whether or not you have ever been sexually active or not. Also, you do not need to start cervical cancer screening before the age of 21, even if you become sexually active at an younger age. So what should I do to prepare for a Pap Smear or HPV test? You need not do anything special to prepare. Your doctor will ask you not to be sexually active for 2 days before, from 2 days before your Pap test, or they'll ask you not to use any medications vaginally or any lubricants or any spermicidal jellies from 2 days before a Pap test. So even your doctor might recommend you to reschedule the test when you do not expect to have your period. Like if you are in periods, they will ask you to postpone it for some time till your bleeding stops. So how often should you be screened for cervical cancer? That depends on how old you are and the results of your past test. If your age is 21 to 29, you should have a Pap test every 3 years, or if your doctor recommends HPV testing instead, you should have a test every 5 years beginning at the age of 21. So if your age is 30 or old, so you can have a Pap smear every 3 years. The other option is having a HPV test every 5 years, or a combination of Pap smear and HPV test every 5 years. So if your age is 65 or older, you can stop having the Pap test. If you have a test done regularly until you turn 65 and you had 3 normal Pap smear tests in a row, or 2 normal combination of Pap smear and HPV test normal over the past 10 years. So you do not have other medical conditions that will weaken your immunity, like HIV, or you're not on any radiation or chemotherapy or any medicines that will weaken your immune system. You might also get a Pap test done for some other reasons also. The doctor will do Pap test done for other reasons other than cervical cancer. For example, if you have a abnormal vaginal bleeding, and your doctor might do a Pap test to try to figure out what is the cause of the bleeding. So do you need to be screened for cervical cancer if you had a hysterectomy? So you have had a surgery called hysterectomy, that is the removal of the uterus. Then you have to ask your doctor, they have removed the uterus along with the cervix or not. So if they have not removed your cervix, then you have to have your Pap test as scheduled. So if they have removed the cervix, then you have to find out what is the reason for removal. If the cervix has been removed for any precancerous, which we call as dysplasia, cervical dysplasia, then again you have to go for Pap smear test done regularly, and you have to continue till 65 or beyond that. Your doctor will help you out with that. So do you need to get screening test if you have HPV vaccine? Yes. Getting the HPV vaccine lowers your chances of getting HPV infection that would lead to cervical cancer, but it does not completely protect you from having the cervical cancer. So you should still go for Pap smear screening. So what if you had an abnormal Pap smear test results? So please don't worry. Abnormal Pap smear tests are common, and most people with an abnormal Pap smear test do not have cancer. If your Pap smear test has cells that look abnormal, your doctor will run more tests to figure out what is the cause of this. They will decide what to do based on your age, what your Pap smear shows, and the results of other tests you had. So the follow-up test might include, so that your doctor might again order you the HPV test along with the Pap smear. If you haven't already had an HPV test, your doctor might order one. They might be able to do this on the cells already which have been taken along with the Pap smear. They might even order you to go for other Pap smear tests done in 12 months. Sometimes, if you wait a year and have another Pap smear test, you will find that abnormal cells are back to normal. So, you might also have a HPV test at the same time. Your doctor might also order you something called as colposcopy. For this test, the doctor will use a speculum to look at your cervix just like that of Pap smear test, Then they will look more closely using a device that looks like a microscope that allows the doctor to see the cervix in more detail. During this test, your doctor might take a tiny bit of sample from the tissue from the cervix. This is called as biopsy, and these tissue samples are checked in a lab. So if you do not have a cervical cancer or a precancer, there are effective treatments as well. If you develop a cervical cancer, then you will have effective treatments as well that can even give you a complete cure if you have been recognized early. What if your HPV test comes back positive? Most people who have sex will be exposed to HPV at some point. And having HPV doesn't mean you definitely are going to develop cancer. For most people, HPV infection goes away on its own. But for some people, it does not. So long-lasting HPV infections increases your risk of cancer over time. So if your HPV test comes back positive, your doctor will talk with you and about what to do. This will partly depend on whether your Pap Smear results were abnormal, or if your HPV tests are positive but your Pap Smear is normal, then you might need to repeat the test in a year so your doctor can see if anything has changed. So this is all about the this is all about the Pap Smear. So at Femcity Hospital, we are offering a very good price to screen for cervical cancer, that is Pap Smear is done only at ₹199. So please grab this chance, and this is only for a limited time. Here at Femcity, we all care for every woman.